Hi, I am Rodrigo Fernando Presotto. I am a psychologist, public health professional here in Brazil, and also a PhD student at Department of Collective Health of the Faculty of Medical Sciences at the State University of Campinas, Unicamp, here in Campinas, in Brazil. I am also a research member of the research laboratory Collective Health and Mental Health Interfaces from the same department in the same faculty at Unicamp here in Brazil. Today I am very proud to have the opportunity to represent the research laboratory of which I am a member and to be able to present to you our work carried out here in Brazil. Our study is named Adapting and Implementation Strategy to the COVID-19 Pandemic Context and is a collective work. I am not the only author, as you can see in the slide. I am very proud for that today to present our work to you guys. Interfaces Research Lab is our research group, and we work here since 2005 in the collective health department here in the State University of Campinas. This presentation represents a part of a bigger research developed in a partnership between our research lab and the municipality of Itatiba in the state of São Paulo in Brazil. Itatiba is a medium-sized city nearby Campinas, where Campinas State University is. This research is possible thanks to the funding from São Paulo Research Foundation, FAPES, through the grants that you can see in our slide. The main research that I am talking about is named Innovative Strategies to Qualify the Mental Health Network in a medium-sized city in São Paulo and Implementation Research. So, to a better understanding of our context, I will provide you a little presentation of our timeline, of our partnership, and of our research. So, we started in December of 2017, and we planned during 2018. Uh, Started by several meetings provoked by the health secretary, the ex-health secretary of Itatiba, who looked for us in Campinas to propose a partnership to provide a better health assistance for Itatiba people, qualifying the mental health services and the mental health network in the city of Itatiba. After several meetings, we founded a committee that uh, we named it Research Management Committee, who is integrated by interfaces members, Itatiba health workers and services managers, uh, Itatiba health department managers, and a local university representatives from Itatiba USF. And after that, we started our pre-implementation phase, uh, doing diagnosis of the Tiba Mental Health Network. So during the second semester of 2019, August to November, we did several surveys with mental health workers and health workers in Itatiba, users, people who utilize the services or in the mental health service in Itatiba and their families. Also, we did our first workshop of community health agents, CHA, who are community workers here in Brazil, of our strategy of family health in the primary health care. And then it was a kind of, this workshop was a kind of awareness strategy to start other actions involving workers in Itatiba. And also, at that moment, we did a survey of that of data in medical records of the participant services in our research, members of our research. Uh, in the second semester of 2019, in December, and also in the beginning of 2020, before start pandemic, we did our first feedbacks of the first analyzed data to Itatiba Health managers and the RMC, the Research Management Committee. And also we provide single feedback of data collected from medical records to each participating service in Itatiba. And so, 2020, that started the COVID-19 pandemic in Brazil. And in 2020 and 2021, we did an adaptation of the professional training model for technology mediated training with the Research Management Committee. And we began a pilot class to understand how visit works, and if it's feasible to do here at our context professional training, technology mediated, in taking place of face-to-face professional training because the restrictions of the COVID-19 pandemic here in Brazil. And so in 2020 and 2021, we developed 4 classes of professionals in professional training here. Around 100 professionals participate of our professional training classes during our implementation research here in Itatiba. Our background related to that is, in the implementation process, is essential to consider the different variables part of the intervention context that influences, impacts, and results. The training offer is a widely used implementation strategy in implementation research. However, its format needed to be adapted due to the restriction imposed by the COVID-19 pandemic. This study seeks to analyze the impacts of adapting face-to-face training of health professionals to the online format. So our method provided by this action is thinking about the mental health training included 97 professionals in 5 synchronous meetings lasting 3 hours each. We utilized videos and questions for previous warm-up and small groups debate carried out using a video conference application with support of a virtual learning management system during the classes, and to connect one class to another without lost contact with the theme and the discussion that we had during these classes. So at the end, a focus group with stakeholders was carried out, aiming to assess barriers and facilitators of adaptation. A narrative of the material was carried out, analyzed from the Gadamerian hermeneutics framework. And so that is our results. With barriers, inhibition for verbal communication was mentioned, increased work overload, making participation harder, difficulties with internet connection in accessibility. facilitators, we had the adjustments of the format allowed the continuity of the implementation, and there may also be a reallocation of the time of the classes from the group's functioning. The acceptability of the training was perceived as dependent of the motivation of the participants, but during the classes, we noticed that the acceptability was very, very positive. And during video conferences, using the chat was evaluated as a favorable form of communication between the participants of the professional training. The use of videos was considered an important strategy for greater participation in the discussions as a warm-up before the professors invited to discuss specific themes. There was incredible productive to the professionals participating in the discussion of the teams. So, conclusion. The training adaptation to the online format was considered adequate as it allowed the implementation to continue, understanding the real possibilities resulting from the restriction of the pandemic context. And the biggest barrier identified was related to difficulties in accessing the internet, which involves specific problems in countries like Brazil, which can be associated with economic and social difficulties. But for implementation research, our work, we think there is very important to show how it's possible to work with professional training in the context of pandemic of COVID-19, sorry, and is feasible and is a tool to increase and to continue our implementation research, not only here in Brazil, but around the world. So thank you very much. I'm ending my presentation right now.